Hi, it's Dr. Jesse Chai, your friendly neighborhood dentist from Bradford Family Dentistry. Can you believe it has been 1 year now that we've been in this COVID-19 pandemic? I know we all hope it is over very soon. Now, I came across recently this article about the link between gum disease and severe COVID-19 complications, and I thought it was very important to share it with you, our wonderful patients, because of what is in there. Now, for years, my team and I have been preaching to you how the health of your mouth increases your risk of the worst diseases out there, including increased risk of heart disease, stroke, diabetes, and even certain cancers like colon rectal cancer and pancreatic cancer. So none of them really good at all. Well, also, it increases your risk of lung problems and lung disease. And so when COVID came out, I urged people to maintain their oral health because I had a gut feeling inside that if your mouth had gum disease, which affects 50% of the adult population, by the way, that you would be way more at risk of problems with COVID-19. Because if you think about it, if your body is already fighting an infection in your mouth, you will be more prone to disease as your immune system can only do so much. I even sent out a few videos throughout the year last year saying that if you want to build up your immune system, then you have to take care of your dental health and treat any issues there, especially any active infection or gum disease, and this will increase your body's immunity to fight anything it may encounter, including COVID-19. Well, the research is now in, and it's even worse than I thought it would be. In it, you will read how the study suggests that people with gum disease could be nearly 9 times more likely to die of COVID-19. 9 times! Than people without dental problems. They also found that those with gum disease were 3.5 times more likely to be admitted to the ICU and 4.5 times more likely to require a ventilator if they got COVID-19. And I mentioned earlier that 50% of the adult population have active full-blown periodontal disease, which is the more severe version of gum disease. Well, that percentage gets worse in our older demographics. In this article, you read it states 70% of people over the age of 65 have some form of gum disease. And that is a significant and likely a big factor why people in that age group are more susceptible to COVID-19 complications and even death. So what does that all mean for you? Well, if you're already coming in regularly for your 3-month or 6-month cleanings and you're proactively having your recommended care addressed, you are much less likely to have any complications or complications with COVID-19 if you were to get it. Now, to say you won't get any complications, but because you are actively and proactively eliminating the infection in your mouth, then your immune system will be stronger. Now, if you have not been in to see us in over 6 months, or worse since COVID-19 started, then I'm pleading with you to come in to resume your care with us. The research is clear. You're putting yourself at risk and your health at risk by not taking care of issues in your mouth. So I know this is some heavy information, but given how important your health is, I wanted to make sure you are armed with the right information to make sound decisions for your health. And so, because I really don't want bad things to happen to you, and especially if, this is, it's very preventable. So my team and I are here to help you when you need us. Once again, I'm Dr. Jesse Chai, your friendly neighborhood dentist from Bradford Family Dentistry. So until next time, we'll see you soon. Take care.